You reach for it every morning, almost like a ritual. That small pill, or maybe a couple of them, taken with a glass of water. It's your multivitamin, your insurance policy. You do it because you want to stay healthy, to maintain your strength and your independence. You do it because you've been told it's the responsible thing to do. A simple way to fill in any nutritional gaps and protect your body as you age. But what if I told you that this daily habit, this act of self-care, could be secretly contributing to your single greatest health fear? What if the very thing you believe is protecting you might actually be causing your risk of a stroke to soar? It sounds shocking, even unbelievable. And it flies in the face of what many of us have been told for decades by doctors, by advertisements, and by well-meaning family members. But leading researchers at one of the world's most respected medical institutions, Johns Hopkins Medicine, have been sounding the alarm for years. They even published a scathing editorial with a title that leaves no room for doubt. Enough is enough. Stop wasting money on vitamin and mineral supplements. They concluded, after reviewing years of data on hundreds of thousands of people, that for the average, well-nourished adult, these pills do not prevent heart disease, cancer, cognitive decline, or death. And worse, as we're about to uncover, some of the most popular supplements, especially those marketed to seniors, may carry a hidden and devastating risk for your brain health. Hello, and welcome. I'm so glad you're here with me today. My goal for our time together is to bring clarity to this incredibly confusing topic. If you feel like you're caught in a whirlwind of conflicting advice, one headline says, "Take this," another says it's dangerous, your doctor says one thing, a health influencer says another, please know you are not alone. That confusion is exactly why we need to have this conversation. We're going to cut through the noise and look directly at what the science says. Over the next few minutes, we will walk through a step-by-step investigation into the world of supplements and stroke risk. First, we'll tackle the biggest myth of all, the idea that a multivitamin can act as an insurance policy against a less-than-perfect diet. Then, we will dive deep into the two most concerning supplements for seniors, the calcium and vitamin D combination that so many of us take for bone health, and the so-called heart-healthy vitamin E. The data on these is startling. We'll explore the hidden dangers of megadoses and why the supplement industry isn't held to the same standards as prescription medication, which is a crucial piece of the puzzle. But this is not about fear. This is about empowerment. So after we understand the risks, we will pivot to what truly works, the proven, science-backed strategies that genuinely lower your stroke risk. And finally, and perhaps most importantly, I'll give you the exact questions to ask your doctor to transform you from a passive patient into a confident advocate for your own health. You will want to stick around for that because it changes the entire conversation. By the end of this video, you will feel more confident and in control of your health decisions than ever before. And a quick but important reminder, I am not a doctor, and this video is for informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. The goal here is to arm you with high-quality information from trusted sources like the American Heart Association and the Cleveland Clinic, so you can have a more informed discussion with your own healthcare provider, who knows your unique health history. Always consult your doctor before making any changes to your supplement routine or lifestyle. All right, let's begin with the idea that started it all, the one that built a multi-billion-dollar industry. This is the myth of the multivitamin as an insurance policy. This is the myth of the multivitamin as an insurance policy. I completely understand the appeal. Life gets busy, and sometimes our diets aren't perfect. We have a piece of toast for breakfast instead of a balanced meal, or we grab something quick for dinner. Taking a multivitamin feels like a smart, proactive step. It feels like you're covering your bases, making up for any shortfall. It's a comforting thought. This idea that a single pill can smooth over the rough edges of our daily nutrition. It's an act born from the best of intentions, the desire to do right by our bodies. But here is the uncomfortable truth, backed by massive studies. For the vast majority of people in countries like the United States who eat a reasonably varied diet and are not suffering from a diagnosed deficiency, that insurance policy may be worthless when it comes to preventing the big things we worry about, like heart attacks and strokes. A huge review published in the Journal of the American Heart Association, titled Circulation, Cardiovascular Quality and Outcomes, looked at data from over 2 million participants. The lead author, Dr. Junseok Kim, stated it plainly. We found no clinical benefit of multivitamin and mineral use to prevent heart attacks, strokes, or cardiovascular death. Let me repeat that. No clinical benefit. It didn't move the needle. Think of it this way. You wouldn't pay for a car insurance policy that explicitly said it wouldn't cover you in case of an accident. Yet, that's essentially what the evidence suggests many of us are doing. The real insurance policy for your health isn't found in a bottle. It's found in your grocery cart and in your daily habits. The power isn't in a synthetic pill. It's in the vibrant colors of fruits and vegetables, the fiber in whole grains, and the healthy fats in nuts and fish. Shifting our focus from a passive pill to active, intentional nutrition is the first and most powerful step toward genuine health security. It's not just a safer choice, it's a more effective one. Now, that brings us to a far more specific and urgent concern, one that directly affects millions of seniors who are trying to do the right thing for their health. Let's talk about the calcium and vitamin D stroke trap. If you're a woman over 60, there's a very high chance your doctor has recommended you take a combination of calcium and vitamin D to protect your bones from osteoporosis. This is standard, well-intentioned medical advice. You see it on the labels, you hear it from your friends, and you do it because the fear of a fracture from a fall is very, very real. You are doing exactly what you've been told is best for your long-term health and mobility. But this is where the science gets incredibly tricky, and frankly, a bit frightening. A comprehensive study from researchers at West Virginia University, which analyzed years of data on nutritional supplements, uncovered a shocking link. They found that taking a combination supplement of calcium and vitamin D was associated with up to a 17% increase in stroke risk. Let that sink in. The very supplement you're taking to prevent one problem, brittle bones, may be significantly increasing your risk for another, far more catastrophic one. This is the very definition of the confusion that concerned Carol, our audience persona, feels. One trusted source says do this. Another trusted source says it's dangerous. So what's going on? The researchers believe the why might have to do with how the body processes large, concentrated doses of calcium from pills. Unlike the calcium we get from dairy, leafy greens, or fortified foods, which is absorbed slowly, a powerful calcium pill can cause a rapid spike in the calcium levels in your blood. Some evidence suggests that this sudden spike can contribute to the hardening of the arteries, a process called atherosclerosis. Think of your arteries like flexible hoses. Atherosclerosis is like those hoses becoming stiff, brittle, and clogged with mineral deposits over time. Stiff clogged arteries are a primary cause of both high blood pressure and ultimately stroke. My own grandmother was religious about her calcium pills for decades. She was so proud of her bone density scans, but she also struggled with stubbornly high blood pressure that doctors couldn't fully explain. Looking back with this new information, you have to wonder if there was a connection. So what is the action step here? It is not to simply throw your pills in the trash and ignore your bone health. That would be trading one risk for another. The empowered action step is to shift your focus to food first. Prioritize getting calcium from dietary sources like yogurt, kefir, cheese, sardines with bones, tofu, broccoli, and dark leafy greens like kale and spinach. For vitamin D, safe sun exposure and fatty fish like salmon are excellent sources. The red flag here? The moment to talk to your doctor is now. Schedule an appointment, not to just get a prescription, but to have a real conversation. You can say, "Doctor, I've read some concerning research from West Virginia University linking combined calcium and vitamin D supplements to an increased stroke risk. Given my family history of stroke, could we discuss the specific risks and benefits for me? Can we explore getting more of my calcium from my diet? And could we test my vitamin D level to see if I even need a supplement at all?" This is how you take control. This idea of a supplement having an unintended, dangerous trade-off leads us directly to our next point, the hidden risk of so-called heart-healthy vitamin E. Vitamin E is an antioxidant, and for years it has been marketed as a champion for our cells, protecting them from damage. It sounds like something that could only be good for you, right? Many people take it specifically, thinking they are protecting their heart and blood vessels. And again, this comes from a place of wanting to be proactive and using every tool available to stay healthy. The reality, however, is a classic example of a double-edged sword, and it's a trade-off that is almost never explained on the product label. A major study published in the prestigious British Medical Journal, or the BMJ, analyzed the effects of vitamin E supplementation on stroke risk. What they found was incredibly nuanced. Taking vitamin E supplements did, in fact, slightly reduce the risk of the most common type of stroke, the ischemic stroke, which is caused by a clot. But here's the terrifying catch. The same supplement increased the risk of a different, often more deadly type of stroke, the hemorrhagic or bleeding stroke, by a staggering 22%. A hemorrhagic stroke happens when a weakened blood vessel in the brain ruptures and bleeds into the surrounding tissue. They are often more difficult to treat and have a higher mortality rate. Think about that trade-off. It's like being told you can slightly lower your risk of a fender bender by driving a car that has a 22% higher chance of the brakes failing completely on the highway. It's a gamble that no informed person would willingly take. My friend's father, a vibrant man in his early 70s, was a health enthusiast. He took vitamin E for years, convinced it was protecting his heart. He tragically passed away from a massive hemorrhagic stroke. While we can never know the exact cause, his family was devastated to learn afterward about this potential link, the risk he was completely unaware he was taking every single day. The action step here is clear and simple. Avoid high-dose vitamin E supplements unless they are specifically prescribed by your doctor for a diagnosed condition. Instead, get your vitamin E the way nature intended, from foods like almonds, sunflower seeds, spinach, and avocados. The red flag is simply seeing a high-dose vitamin E supplement on the shelf marketed for heart health. That label is, at best, a half-truth, and at worst, a dangerously misleading claim. All right, let's just take a quick pause here. We're halfway through, and we've already covered some incredibly important and perhaps surprising information. We've learned that the idea of a multivitamin as a simple insurance policy is largely a myth for most people. We've uncovered the shocking link between the common calcium and vitamin D combination and an increased risk of stroke. And we've just seen how vitamin E, a supposed health supplement, presents a dangerous and hidden trade-off. This is a lot to take in, but knowledge is power. If you are finding this deep dive helpful and it's bringing some much needed clarity, I would be so grateful if you took just a moment to tap that like button below this video. It truly helps our channel reach and empower more people just like you who are searching for trustworthy health information. Thank you so much for that. Now let's continue. The issues with vitamin E and calcium hint at a much broader problem, which is the more is better mindset that dominates the world of supplements. This brings us to the danger of megadoses. We see it everywhere. Maximum strength, high potency, ultra formula. The marketing implies that if a little bit of a vitamin is good, then a whole lot must be great. This can be a particularly dangerous way of thinking when it comes to certain types of vitamins. Here's the simple science you need to understand. Vitamins are generally categorized into two groups: water-soluble and fat-soluble. Water-soluble vitamins, like vitamin C and the B vitamins, are relatively hard to overdose on because your body just flushes out what it doesn't need through your urine. But fat-soluble vitamins are different. These are vitamins A, D, E, and K. Think of it like this. Your body's ability to handle water-soluble vitamins is like a sponge. If you pour too much water on it, the excess just runs off. No big deal. But your body's ability to handle fat-soluble vitamins is like a jar. They don't just run off. They get stored in your body's fat tissues and liver. If you keep pouring more and more in, the jar overflows, and it can build up to toxic levels, creating a serious mess. For example, as WebMD points out, while vitamin B6 is water-soluble, taking extremely high doses over a long period of time has been linked to severe nerve damage, causing loss of feeling in the hands and feet. And with the fat-soluble vitamins, the risks are even greater. We've already discussed the stroke risk with vitamin E. But excessively high doses of vitamin D, far beyond what anyone could get from the sun or food, can lead to a buildup of calcium in the blood, which can cause nausea, weakness, and in severe cases, kidney problems and serious heart rhythm issues. Now you might be asking, if these mega doses are so risky, why are they even sold on the shelves? This is a crucial question, and the answer lies in a piece of legislation from 1994 called the Dietary Supplement Health and Education Act, or DSHEA. This law was the result of a massive lobbying effort by the supplement industry. It effectively reclassified supplements as a special category of food, not as drugs. This means that, unlike prescription medications, supplement manufacturers do not have to prove to the Food and Drug Administration, the FDA, that their products are safe or effective before they go to market. The FDA can only step in after a product has been proven to cause harm. This puts the entire burden of safety on you, the consumer. It's why you have to be such a vigilant detective for your own health. The action step is to be deeply skeptical of any product labeled megadose or high potency. The red flag is any supplement that provides several hundred or even thousands of % of the recommended daily value of a fat-soluble vitamin. More is not better. Appropriate is better. Now that we have a clear picture of what doesn't work and what can be harmful, it's time to pivot to the most important part of our conversation, The real stroke prevention strategy. Because the wonderful, empowering news is that you have incredible power to reduce your stroke risk. And that power is not found in a pill. It's found in your daily choices. This is the information that truly puts you in the driver's seat of your health journey. The Mayo Clinic Health System has outlined the most effective strategies, and they are refreshingly straightforward. The single most important thing you can do to prevent a stroke is to control your high blood pressure. Hypertension is the silent killer because it often has no symptoms, but it relentlessly damages your arteries, making them ripe for a clot or a rupture. So the action step is to know your numbers. Get a home blood pressure monitor, use it regularly, and work with your doctor to get your pressure into a healthy range, whether that's through diet, exercise, or medication if needed. Second is eating a diet that is rich in fruits, vegetables, and whole foods, and low in sodium, processed junk, and unhealthy fats. Remember our conversation about the insurance policy? This is it. This is the real thing. I remember my own father, a man named Bob, who insisted his blood pressure was just a little high. He thought his medication was all he needed. But after a stern warning from his cardiologist, he started making two simple changes: a 30-minute walk every morning and swapping his daily canned soup, which is often a sodium bomb, for a homemade version packed with vegetables. Within 3 months, his blood pressure was in the healthy range for the first time in a decade, and his doctor was able to reduce his medication. It was a powerful lesson in how much control we really have. Other key strategies include regular physical activity, maintaining a healthy weight, not smoking, and managing conditions like diabetes and atrial fibrillation. These lifestyle factors are the bedrock of stroke prevention. They are the proven, time-tested methods that really work. They may not be as simple as swallowing a pill, but their benefits are infinitely more profound and far-reaching for your overall health. This brings us to our final, and perhaps most critical point. We've armed you with a lot of information today, but the ultimate key to using this knowledge is in how you communicate with your healthcare team. It's about how to talk to your doctor and become a truly empowered patient. Many of us, especially from generations that were taught to see doctors as unquestionable authorities, can feel hesitant or intimidated to ask tough questions. It can feel like we are challenging their expertise. But I want to reframe that. A good doctor wants an engaged patient. You are not challenging them. You are partnering with them. You are the world's leading expert on one subject, your own body and your own life. Sharing your concerns and asking detailed questions helps your doctor give you the best possible, most personalized advice. Instead of asking a general question like, "Should I take a multivitamin?" which invites a general one-size-fits-all answer, you need to ask specific, targeted questions. The health experts at the Cleveland Clinic recommend this approach. Here are the exact words you can use. You can even write them down and take them with you to your next appointment. First, you can say, "Doctor, given my personal health profile, my diet, and my family history, what are the specific, evidence-based risks and benefits of this particular supplement for me?" This question forces a personalized answer, not a generic one. It moves beyond the simple "take it for bone health" and opens a discussion about your stroke risk, your kidney health, and your other individual factors. The second powerful question is this: before I start taking a supplement for a potential deficiency, can we please run a blood test to see if I am actually deficient? This is such a simple, logical step that is so often skipped. Why take a powerful iron supplement if you aren't anemic? Why take high-dose B12 if your levels are perfect? Test. Don't guess. These questions transform you. You are no longer just a passive recipient of advice. You are an active participant, a co-pilot in your own healthcare. This is the ultimate goal. It addresses that core feeling of confusion and not knowing who to trust by making the conversation a collaboration between you and your doctor, grounded in your specific data. So let's bring everything together. We began this journey feeling confused, maybe even a little scared, standing in front of that medicine cabinet. But look at how far we've come. You came here worried about a hidden danger, and now you leave armed with empowering knowledge. This is a huge victory for your health. You now know that the multivitamin insurance policy is a myth, and that real health insurance comes from your lifestyle, not a bottle. That's win number one. You understand the specific and serious stroke risks associated with the common calcium and vitamin D combination and the so-called healthy vitamin E, allowing you to sidestep these hidden traps. That's win number two. You know why megadoses can be dangerous and why the supplement industry requires your vigilance. That's win number three. Most importantly, you are now crystal clear on the real proven strategies that actually prevent stroke, like managing blood pressure and eating whole foods. And finally, you have the exact language to speak with your doctor to ensure you get personalized care that is right for you, making you the leader of your own health team. That is the ultimate win. The core message today is not that all vitamins are evil or that you should never take a supplement. For people with diagnosed deficiencies, supplements can be life-saving. The message is that context is everything. Your dose, the form of the vitamin, your personal health history, and your diet all matter. The message is that you should be skeptical of marketing claims and trust in evidence. And above all, the message is one of power and autonomy. You are not at the mercy of confusing headlines or aging. You have the power to ask the right questions, to focus on what truly works, and to build a lifestyle that genuinely protects your brain and your body for all the vibrant years ahead. Now, I would love to hear from you. Which of these points was the biggest aha moment for you? Was it the information about calcium and vitamin D? Or perhaps the truth about vitamin E? Please share your thoughts and experiences in the comments below. Reading your stories helps everyone in this community learn and feel less alone on their health journey. And if you enjoyed this deep dive and want more clear, science-backed health information to help you thrive, please be sure to hit that subscribe button and ring that little notification bell so you won't miss our next video. Thank you so much for spending this time with me today. It's an investment in your most valuable asset, your health. Be well, stay empowered, and I'll see you in the next video.